Hi, good afternoon. This is Emily Lubring, Director of the Federal Programs Unit, and I'm with...
This is Dwayne Shoemate, Coordinator of Employment Community Engagement.
And we also have Leslie Bradley, also with Federal Programs Unit today to help with the question and answer process. Next slide. We're going to go ahead and first off, I wanted just to mention, just a reminder that the question and answer document from our October 12th service definition training is posted online with the webinar information, previous webinars, and you also may have also received an email yesterday with that link for the question and answers from the original training on October 12th. And now I'm going to hand it over to Dwayne.
All right, thank you. So today we do not want to go back through in detail the training that we did back on October 12th. What we'll do is just a quick highlight of the service definition changes that were made, and then we'll jump into any questions and answers that you all have today. So just as a refresher, benefits planning is one of the new waiver services that was included in the waiver application. Again, this is available in the comprehensive community support and partnership waivers. This is an individualized service, and the intent of this service is to help individuals who may be considering employment or seeking employment or already employed to help them understand what the impact of earned income would be on their Social Security benefits, Medicaid benefits, and other public services and benefits. And if we can advance the slide. The main thing with benefits planning is that the individual does not need to be present in all aspects of the service delivery, as there are pieces where a certified benefits planner may need to be coordinating calls with Social Security or the Family Support Division or analyzing benefits planning queries. So the individual does not always have to be present for the provider to be able to deliver the service. In order to receive this service, we do need to first utilize the comparable benefit that is available through the Missouri-based Social Security Supported Work Incentives Planning and Assistance Program. In Missouri, one of those is located with Missouri Protection and Advocacy, and the other is available through Paraquad. So individuals would first need to attempt to access those programs, but if those programs indicate that their support is not readily available to the individual or accessible for them, or if they're going to be on a list where it may be more than 30 days before they're able to support the individual, then the service would be available. The WIPA program's primary audience is to work with individuals who already have a job that are needing to make some decisions, or to work with those individuals that already have a specific job goal and to have an earnings goal. So in the circumstances where they don't, an individual doesn't fit their priority category, or it's going to be a period of time, then this is when the service should be utilized. The service is to be delivered by a provider that has a staff person that's been credentialed through either Virginia Commonwealth University or Cornell University. So there are very specific criteria on credentialing to deliver this service, and that's outlined in the service definition. And this service is limited to 60 units per annual support plan year. We'll go ahead and advance the slide and just ask questions that you have in the chat box, and we'll begin to answer the questions after we get to the conclusion of the update. Community networking is available in the Comprehensive Community Support Partnership and MOKIDS waiver. Again, this is a service that can be done on an individual or group setting. This is the new definition or new title for what we previously knew as community integration. In the new waiver application, we did clarify the expectations around outcomes for individuals to be able to participate in and choose activities that build social relationships, community involvement, and that builds upon an individual's specific interests, preferences, gifts, and strengths. So the service really is intended not just to be a service that's delivered when an individual is out in the community as part of a field trip or things like that. It's really more purposeful around their desires to truly become integrated as part of community involvement, to truly build social relationships and advance membership in different community programs, organizations, and activities. Next slide. Community networking is limited to 432 units within a month. And in the past, we've had instances where individuals have done what we'll call volunteering in the community as part of community integration. So what we are clarifying is if someone's doing community service solely for leisure purposes or avocational interests, then that continues to be community networking. But if they are doing unpaid work experiences or volunteering as part of an employment pathway, then those programs really should be being delivered underneath the pre-vocational service definition. Next slide. Individualized skill development. Again, this is available in the Comprehensive Community Support Partnership MOKID's waiver. This is available to individuals and groups. Clarifying language was added that it is for individuals who live in their own home or their family homes. So this service, just like community networking, is not available to anybody within shared living, residing in an ISL or group home. The service limit for this service is 348 units. And again, language was added to clarify the outcomes that are needed as part of this service. And next slide. So we'll move on to day habilitation. Again, as has been the case for several years, day hab is available in the Comprehensive Community Support Partnership for Hope and MOKID waivers. Language was updated to indicate that this is available for all individuals to include and support retirement activities, that the services are predominantly designed to assist individuals to acquire, improve, and retain self-help, socialization, and adaptive skills and skill development. And again, day hab can be provided within a fixed site setting or in the community. And moving on to the next slide. Most of the changes around day habilitation was language that was included in the medical exception and the behavioral exception. In the medical exception, language was revised to indicate that documentation required for requesting this from the UR committee is a written support plan that includes clinical outcome data with criteria for reduction of supports, if relevant, to the identified medical condition. This wording, the only change in this wording from before is that we took the word as out and replaced it with if. So if it's relevant and needs to have a reduction or support, but if it's not relevant for the individual, if there's not that ability to reduce supports, then the supports don't necessarily need to be reduced. It's just if it's relevant for the individual based upon their medical condition. Also, written documentation noting the individual's assessed need for medical or mobility supports is required from the individual's medical practitioner. And the next slide, we'll talk about the behavior exception language. The revised language here indicates that people with exceptional behavior support needs may be granted a behavior exception when additional staffing is required to keep them or others safe. Request for a behavioral exception is to be submitted to the UR committee and include one of the following pieces of documentation. The ISP needs to include a behavior support plan, including the supports to be implemented through the day hab service and confirmation of ongoing applied behavior analysis services, or the ISP documents that behavior supports have been recommended and are being pursued. So moving on to the next service, Career planning, which is available in the Comprehensive Community Support and Partnership for Hope waiver. Relatively minimal changes in this service definition. There was just some clarification and revision to the language to kind of align with national best practices. Again, we clarified that transportation for the implementation of the service are included in the rate. So as an individual is receiving career planning and needing to be transported from community site to community site, that transportation is included in the rate. But this does not include transportation from the individual's home to the site of service. Also, we just added, as far as an additional billable activity, is the consideration of how assistive technology could be used to help the individual as part of that career planning process as they review and consider their interest or visit community work sites. Next slide. The largest change in career planning, as with all the employment services, is adding language around expected outcomes. This was part of the service advisory team's recommendations. These outcome requirements are also in place to help us as we move forward and looking at trying to, in the future, move from a unit of implementation around a quarter hour to ultimately be able to get to an outcome or milestone payment process. So in career planning, the outcome is that it identifies an individual's career path and that a profile is developed which includes the individual's needs, their strengths, their interests, a consideration of what type of natural supports they might need in that career path, as well as the type of work environments that may be needed, and then a plan that indicates those services and supports that are being necessary to achieve their career goals. So this should be included as a plan and being monitored by support coordinators as part of that process of individuals completing those programs and services. In job development, again, it continues to be available in the Comprehensive Community Support and Partnership Waiver. Language, again, was updated to reflect national best practices. Similar to career planning, it was clarified that transportation for the implementation of the service is included within the rate, but that does not include the transportation of getting the person from their residence to the service site. And again, we included language here to ensure that as part of meeting with an employer and looking at a potential job match, that if the provider is working with the employer on the potential ability to have assistive technology available to help the person in pursuing a potential job, that those are discussions and activities that could be occurring with the potential provider and considered as a billable activity. So as we move on to the next slide, again, for job development, the outcome expected is becoming employed and having a retention plan on now that a job has been found, how is the individual going to be supported on that job? So within this outcome, retention plan is an outline of the job title that the person secured, their wages, and the projected number of hours that they'll be working, as well as just the strategies that will be needing to be implemented to help the individual be able to retain that employment. And I think you'll understand that the job title, wages, and projected average number of hours of work, those have been mandatory expectations in the ISP guide for quite some time for the support coordinator to be documenting. And by including it here, we're just ensuring that the service provider is getting that information to the support coordinator so it can be included as part of their ongoing documentation and monitoring. So as we move to the next slide, with supported employment, the additions here really were more so focused on just kind of that incidental reporting of earned income to Social Security and Medicaid that may need to occur to ensure that a person does not get into overpayment status. That is a billable activity in support employment. That is not to be confused with benefits planning. This is just the simple reporting of earnings to Social Security and Medicaid. But again, if someone's really needing to look at earnings and wages and how it impacts benefits and consider Social Security work incentives, those would all be part of the benefits planning service definition. So as we move to the next slide, the outcome requirements here is just monthly at the conclusion of monthly provision of service, that there needs to be a plan indicating how the person's progressing on the job, what their ongoing needs are, how paid and unpaid supports are going to be coordinated in that next month, and then what type of implementation strategies will be implemented over the course of the next month to help that individual become more independent and autonomous in that work setting. As we move on to the next slide, Pre-Vocational continues to be available in the Comprehensive Community Support and Partnership for Hope waivers. Again, some clarifying language here. Again, that if someone is volunteering for the purposes of an employment pathway, then they need to be utilizing Pre-Vocational and not community networking. If the person is doing community service that's not related to an employment pathway or being used to measure employment potential, then that all should be being done through community networking. If it is part of a pathway and part of developing work-related skills, then it should be being completed under Pre-Vocational. The service limits here, we removed the previous weekly limits based upon feedback from our stakeholders. And what we did was the number of units that previously was in place was 2,080. So as opposed to limiting that across a week or a month time frame, we just made those units available over the entirety of a planned year. And again, we did add language in Pre-Voc to include informal discussion about asset development and financial literacy, as well as having discussions around the consideration of apps or technological devices that could be used to help the individual in preparing for future employment opportunities. And as we go to the next slide, the new outcome here is to include a monthly plan on just what are the skills being developed. We need to ensure that if someone's getting Pre-Vocational, that there's an identification on what those 2 or 3 skill development areas are, kind of what the desired threshold is that's being developed, and how implementation is adjusting to ensure that those skills are being developed. One of the things that we have seen in the past is when individuals utilize Pre-Vocational, they've just indicated that someone's needed Pre-Vocational services with no specific identification on the skills being developed or the thresholds to be developed. And then an individual will complete the entirety of the limit, and then they'll request an additional amount of Pre-Vocational. And so we just need to ensure that Pre-Vocational has a defined endpoint and that everybody understands, to include the individual, of what and how that endpoint is going to be achieved. So again, that goes back to identifying what are the specific skills being developed, how are they being developed, and what is that level of behavior or threshold of skill demonstration that everyone is targeting. And as we move on to the next slide, we are ready to go through the questions and answers. So Emily is sliding back up to those questions, and I'm going to take a breath and get a drink, and I'll let Emily read the first question.
Sure. When will coding be available for benefits planning, and when will we be able to request this service? So for the first part, when will the code be available for benefits planning? That is actually the actual code is being finalized and approved by MoHealthNet for the payment piece and MMAC for the auditing purpose. It is close to being approved, but I can't say yet which code that's going to be. But we do have a code in mind, and it's going through approval process. And then when will we be able to request this service?
The service would be able to be requested as soon as that code is assigned from MoHealthNet and as soon as contracts have been executed with the providers out there. I know we already have at least one provider that is provisionally waiting for the approval of that final code from MoHealthNet. So that'll just be a matter where we'll be keeping a list of those approved providers and getting that out to where individuals know who those providers are so they have it available for their choice document. The next question related to benefits planning is if they already have been receiving benefits planning through career planning, do they still have to go through a WIPA program? So in career planning, career planning contains many billable activities. Previously, one of those billable activities was benefits planning. So as we have the code available and as providers become available, individuals should be, over the course of their plan year, be transitioning over to the benefits planning service definition, which means benefits planning with a trained and credentialed benefits planner, and individuals should be accessing comparable programs through their WIPA program. And so that requirement really would be no different than what it should have always been, and that is we shouldn't be accessing a service without first demonstrating that the comparable benefit has already been accessed. So folks should just continue to receive the career planning as we get providers onboarded. Folks should be transitioned. Again, we should always be considering a WIPA program as a comparable program prior to authorizing those services. Next question is, can staff continue to provide support through DB 101 if staff is not certified as a benefits planner? So for those who may not be familiar with DB 101, that is a website that the Division of Developmental Disabilities cost shares with the Division of Behavioral Health and Vocational Rehabilitation. So that website is a resource where individuals can go out and answer general informal questions about one's ability to work, how general benefits might be impacted. That level of informal support, just utilizing existing resources, that's fine for those to continue to occur. And we want to continue to inform individuals on their ability to work and have earned income, and kind of busting those myths and demystifying some of the facts from fiction. But if a person is really looking at needing someone to consider earned income, considering all of their other public benefits, the type of work incentives that they have available, that should be when the benefits planning service definition is being utilized. And so the analogy that I would give would be kind of like with public health. I mean, obviously as a parent, you have a general idea of if your child's running a fever, what type of medication you should be providing them, and you have a general idea of general first aid needs. But when it comes to attempting to diagnose whether your child has strep throat or other conditions, that's when you really need to be consulting with that higher level of health professional. And so the same is true here with benefits planning. Some of that general information that can be ascertained through DB 101 or other informal training, that's definitely fine to be being provided. But if someone is needing more formalized consultation around work incentives and the impact of earned income on multiple benefits and the nuances of that, that's when the benefits planning service should be accessed.
The next question is, are there any providers who currently have this service or have shown interest in providing it?
We do, through the division, we are offering a stipend for providers to complete the certification program through Cornell University in order to build capacity of the service. We've currently had about 18 providers who have staff that are either previously completed that certification process or actively working on that certification process. So we do anticipate a large number of providers onboarding this service as soon as they meet that credentialing criteria. We also had providers prior to the benefits planning service definition that had sent staff through these certification courses several years ago. And so as long as those providers and that staff person have continued their credential and certification, they would be able to add that service definition. So there should be a multitude of providers throughout the state that will be able to offer this service.
Okay, thanks, Dwayne. The next question is also about benefits planning. Can only benefits planning be billed for if the agency or person providing service is certified?
Correct. So part of the provider type in the waiver application specifies the national credentials that a person has to have in order to be able to get contract in delivering the benefits planning service. So only those providers that employ staff that have that credentialing and certification would be able to deliver this service. The other thing I would just point out is that the requirements of conflict-free case management continue to exist. And so a TCM could not be billing and delivering the service for someone that they're providing case management to. You know, there would need to be a firewall between the support coordination agency and the service provider of this service.
Thanks, Dwayne. That was the next question about TCMs providing benefits planning. The next question is, if you have a client getting community integration currently, will their plan need to be modified to community networking? The answer to that is no. The change is only a name change. There will be no change in it's not necessary to update the plan. And then along that same lines, CN replaces CI. Is this the same service billing code used? And I believe, let me just double check, but I believe that is correct also, since it's just a name change. We can come back to that and I will confirm.
Actually, one of the questions that was previously asked also asked for some clarification on what it takes to become certified. So the course for that certification through Cornell University, it is a full semester course that has multiple online courses, and then individuals have to go through a file review and pass a exit exam. And so anybody who may be interested in offering that service that currently doesn't have that training and would be interested in that training, I would just encourage you to contact the provider relations vendor specialist staff in your regional office, and they will be in contact with Sandy Kaiser, who's our employment first specialist that's overseeing that registration process. And so they can get information out to you on how to go about getting that contract.
Thanks, Dwayne. And I was also able to confirm that it's the same billing code for CI and CN, so no changes there. Okay, next question. What if supports were added to allow residential staff to now solely provide, what if any, supports were added to allow residential staff to now solely provide CN, especially in the light of staffing shortages and the many other responsibilities required for DSPs?
So as far as the residential services, because the group home, ISL, and shared living services already have elements and expectations of helping an individual access the community and build upon their community membership and integration needs. Those services were already contained within the service definition. So the majority of the states had already been following that guidance. There's just a small handful of situations where that had not been occurring. This was an expectation and clarification from CMS to ensure that we were not duplicating service and supplanting expectations that already occurs within our residential services. As far as what additional supports were added, I would say this is just a clarification that it's already the expectation in a residential service to meet those support needs of community networking, as well as ISD and personal assistance.
And also you'll also find in our Q&A document this similar question about options for the PA, CN, and ISD services. Service alternatives include day hab, employment services, included increased ISL staffing patterns, and remote supports for ISL only.
So if someone was in a residential program and because of staffing shortages, they may not be able to provide all of the support, then those would be some other alternative services that could be accessed, what is helping someone potentially pursue their employment pathway and making a request of employment services around that need, or potentially working with a day hab provider.
Next question again is, what is the start date for these services? Just kind of a reminder, they've been approved. The waivers and the start of the services it's all approved with the approvals of the waivers. So it's kind of back to what we had, what Dwayne had said before, finding those providers, and then as soon as you have the codes available to you.
The next question is, does day hab have to be provided in a group, or could an individual utilize this? So there has been no change in staffing ratio or how that support and service has been delivered. As far as it being offered as an individual service, honestly, that's an answer I should know right off the top of my head, but I don't want to give an answer without checking on that with being 100% confident. So that's something that we will get back out to individuals. Let's see, we're scrolling through questions there. Okay, it looks like the next question is, who is responsible for determining if a person is going to be a priority for WIPA services? Is that done by someone else before a referral is made for benefits planning? Not unlike any other service, that consideration of alternative and comparable benefits should be conducted prior to requesting it in an ISP. So, it would be the support coordinator, working with a consideration of having made a referral and documenting whether or not those services are available. I mean, if that has not occurred prior to the UR process, I can assure you UR is going to be asking if that's been considered. And so it really should be the support coordinator checking to see if WIPA is available before including it as a requested service through the waiver. Otherwise, what will happen is that will be asked in the UR process and likely lead to a denial of that request.
Okay, next question is, how often should a person in DAHAB be evaluated for employment?
So that question, I mean, that's really beyond just any changes that we've made in the waiver application. As required in our employment first state policy, and as required currently in our support coordinator manual and ISP guide, individuals should be annually, there should be a discussion occurring with the individual around interest in pursuing employment. So whether they're in DAHAB setting, residential setting, or any other setting, there is a requirement of annually having the discussion with the individual about potential interest or need in pursuing employment.
The next question we have here, we're actually going to not answer in today's session. It may be answered in one of our upcoming ones, and we'll also add it to our question and answer document. And the question is a medical documentation for meta behavior exception provided once at the inception of this level of support or every year with a new ISP and service request? That fits probably better with a different group and presenters. So we'll bring that question to one of our additional sessions. The next question we have is regarding I think it's the removal of not the removal, but the transition of CN services, PA services, and ISD from group.
Yeah, and I'll read the question, and it's going to be another one that we will get to the person who would best be able to answer this question. But the question is, the question I've come across is when an individual is receiving residential services and we're receiving the CI ISD service, and it's termed out because it's included in the residential service, would the goals need to be updated in the plan when the annual authorization is due and only residential is authorized? So that's really going to be a question that our support coordination leads and teams that are responsible for the ISP and planning and writing goals and outcomes, that's really going to be something that they can best address on how that needs to be included. So we will get that question to them and get it added to the Q&A document. The next question is, in support employment, what staff is expected to assist in wage reporting? What I would say is there's not an expectation that staff are assisting with wage reporting, but if a provider utilizes staff to assist a person with wage reporting, we simply added it as a billable activity. So if a direct support professional or is assisting that individual with simply reporting earnings to Social Security or to FSD, that's a billable activity, but we don't have any specific guidance in the service definition as to what staff expectations are. It's listed as a billable activity if needed.
Okay. Next question is, will a copy of this presentation or this recording of this presentation be available, and that the PowerPoint will be posted with a recording on the division's webpage? You can look under previous webinars for this information. Next question is, are employment services to be reviewed by UR every year, plan year, or can they be ongoing from one plan year to the next without UR review?
That's a question that we'll record, and again, that would best be our UR lead who could answer that question.
Okay. When will the new waiver manual be out with all the changes? Yeah, this question we have gotten already in the previous training. This is also, the manual is being reviewed by MoHealthNet and for finalization of the changes. We're really hoping to get this out sooner than later. We understand the need for it. So yes, changes are all in place. We're trying to get it reviewed and finalized.
The next question is, can the planning team still request additional pre-vocational units if they exceed the 2,080 units in the annual plan year, but identify that the individual still needs to work on skills? Therefore, is there still the exceptions process for the regional director? And that has continued. So with each of the employment services, if there are service limits, there is language in the waiver application that indicates exceptions can be granted with documented need. And so part of the reason of also specifying the outcomes expected within each of the employment services is hopefully that will also assist with having those exceptions reviewed and approved, because everybody will have a more universal understanding of what those outcomes are, and there'll be more clear documentation to support when someone is needing an exception. Next question is, what is the procedure code for benefits planning? I think we've already covered that is going through a review process currently with MoHealthNet. Wanda Crocker, our lead with provider relations, is on the call, and she put in her response to that. And what she has indicated is when a code is available, providers will need to notify the provider relations vendor service coordinator that their contract needs to be amended, and they will connect them to the enrollment and rate team. Next question is, how do we ensure as a provider that we are included on the list of approved providers? I'm assuming this is related to the benefits planning question. What I would say is, as you get benefits planning added to your contract, is to definitely work with your regional office team to ensure that in their choice documents that are being developed, that you're included on that. Individuals are also able to just email me, or you can email the DD mailbox, and we can also ensure that all of those lists are current and updated. The next question is, the Q&A document that came out implies that there are no more group codes for PA, ISD, CN, community networking. That there's been no change in the ability to offer services that were previously in group. And so if there's an answer in the Q&A document that implies that we've eliminated group in some of those services, then we will ensure that that language is corrected, because there should be no change on what was previously able to be done as group continues to be done as group, and what was previously able to be done individually continues to be able to be done individually. So if I'll maintain some anonymity, but I'll just use first name. So Greg, that asked that question, if you could reference the specific question that you feel is implying that group's no longer available, we'll make sure we look at that answer and get that corrected. And again, you can either post that in the chat box, Greg, or on the screen at the DD mail. And if you post that particular section where you're interpreting it that way, we'll make sure that we get that fixed. The next question is, will specific protocols, forms be developed to document the outcomes and action planning associated with each of the employment components, or can providers develop their own? Currently, we've just identified the elements that are expected, and so we're just wanting to start that process of providers ensuring that they have documentation and reports that contain that content, and for support coordinators to be monitoring for that content. In the future, we will be looking at a more formalized reporting process, and we do have in our future plan to be looking at potential pay for reporting. And so as we continue to progress along those pathways, we will begin to specify some of the specific components. But at this time, as long as the elements identified in the service definition is being accomplished, there are not specific forms. It's just a matter of ensuring that content is present in the provider's documentation. Next question is, pre-vocational still limited to 6 months authorization at a time, or is that service authorized now available for a person's entire plan year? The changes that we did make in the waiver indicates that it's 2,080 units across the plan year. So that 6-month limit, as well as limits available within a week, have been removed to provide greater flexibility and innovation by the provider and best meeting that individual's needs. So it would be authorized on an annual basis, and then if there is the need to go beyond that 2,080 units, that could be requested through an exceptions review process. Sean asks on the monthly retention plan for the support employment services, when those are expected to begin, and are providers being made aware of this. This training, as well as the question and answer document and the service definitions, have gone out to support coordinators and providers. So providers should be aware of those expectations. And as far as starting to document those retention plans, I'm looking at Emily, and I think we probably just need to do a quick consultation with our federal programs team, and so we will flag that question and get that responded. I have a 98% confident answer, but I've assured people that I will not give an answer unless we have 100% shared agreement on that. So we will get that response out to you as soon as possible. Next question is, can community network be individual and group, and can the group be 2, 3, or 4? Community networking has always been available as an individual service or as a group service. We just indicate that the group cannot exceed 4 people. So community networking could be 2 people, 3 people, 4 people, or it can be done individually. The next question is, with the name change from community integration to community networking, will new provider choice forms be needed to reflect that name change? It is the same service. It's the same name. You know, we definitely would want individuals updating those forms to be reflective of that name, just as soon as they're able to get that completed. And so, yeah, it's not necessary to preclude it because it's the same service, but obviously we would want people updating any choice forms that they're utilizing to now say networking instead of integration. Next question that we'll need to, I'll read the question and then we can consult with others who would be more applicable for. The question is, when is it expected that CI and ISD should be removed from support plans for individuals who live in residential care facilities? We'll consult with others, but residential care facilities are not waiver funded sites. So the language that we have is specific to group home, ISL, and shared living. But whether that service is or isn't available for folks in RCFs, again, we'll confirm that answer with others just to get that guidance out. Unless Emily's confident in answering that question. Okay. The next question is, how are residential providers monitored to ensure they're providing community networking services? What I would clarify here, it's not that residential providers are providing community networking services. It's that the elements that comprise community networking services are an expectation of each of our residential services. So as part of the monitoring process that a support coordinator does, an individual's community engagement and community membership needs should be occurring as part of that plan development and ongoing monitoring. And so any individual's desire to access the community and participate in community activities should be part of each and every monitoring process to ensure that the residential provider is meeting the individual needs, not just within the home, but also their needs as part of the community.
So here's a question that kind of piggybacks off a little bit about the previous question. If we have individuals with PA and CN, and it also include ISD services that live in an ISL, should this be ended immediately? And so you can also include ISL, shared living, and group home to this question. An email blast, a memo just went out through an email today about the transition of those services, and that is, it provides a transition period for that transition, and with, I believe it's September 1st, 2022 to have that transition completed. It should be done obviously as soon as possible, but the division is aware that this is a change and it would require some transition to make that change.
So the next question is to exhaust the WIPA services. So this is related to benefits planning. Who specifically would we need to contact at Social Security Administration, Missouri Protection Advocacy, or Paraquad? So first and foremost, don't contact your Social Security office. Social Security offices do not provide the WIPA programs. So the WIPA services are through Missouri Protection Advocacy and Paraquad. So depending upon where you reside in the state, depends upon which of those two WIPA programs are your assigned program. So what individuals should be doing is contacting their applicable WIPA site, and if the individual is able to be met with within 30 days, and if they indicate they're able to meet that person's needs, then they would utilize those programs and services that our WIPA programs in Missouri have provided for 15 plus years. But if in contacting that WIPA program, If they indicate that they currently have a waiting list and that they're not able to meet with the individual or they don't meet their priority category, then that conversation and should be recorded and archived as the documentation to indicate that that service is not currently available or accessible to the individual. With the benefits planning, not unlike all the employment services, we should never be contacting another agency and telling them, I need you to document to me that you can't provide the service. What we should be doing is making referral programs to the appropriate programs. And if those programs indicate that the person's either not applicable or eligible or available to access, then at that point in time, that opens the door to have it funded through the waiver, but we shouldn't be contacting them saying, I need this from you because we want to fund it through the waiver. We shouldn't be funding anything to the waiver if it's available through the other programs, first and foremost. Question is, what is the rate for benefits planning? We'll need to look that up. I don't have that immediately in front of me. It is a flat fee service rate, so all providers of benefits planning would be getting the same rate. Can benefits planning services be done remotely? As indicated in the service definition, there are elements of the service definition where the individual need not be present. So there is that ability, to be able to deliver that service without the individual being present. If the question is, can this be done through telehealth option, that's something that we will need to consult with MoHealthNet and FPU because it's currently not listed as a telehealth service. Okay, looking through additional questions, and we're trying to ensure we're not duplicating questions. And we've got several here that have been asked multiple times, so we'll search.
Here's a good question. Just to kind of, as we wrap up, there's a question about where the Q&A document from the last session with the question and answers are. It would have been in an email blast, a link in the email blast about this session and the upcoming sessions. You'll find it there. Also, if you don't have that, you can find it on the DD webpage. If you go into the DD webpage, you could click on the information about for providers, and then over to the right, you'll see webinars. Click on webinars, and then look at previous webinars and go to October 12th. There is a link with all of your a lot of resources there, recorded session, PowerPoint from that session, and then the Q&A and programmatic changes. I would guess also you might find it from this session as well for the October 21st session. You'll find that there also when we get it posted with the recording of this. So, but for right now, you can definitely go ahead and find it there on previous webinars for October 12th. So we are wrapping up the hour and just kind of quickly glancing through if there's any additional questions that we could answer quickly.
Thank you, Greg, for clarifying the row in the Q&A document that you felt implied we have eliminated group. So we'll look at that and ensure that that language is clear, that services that have been delivered in the past as group can continue as group, and those that are individual can continue as individual. We've got a lot of very long questions and a lot of remaining questions, and I'm not for sure, since we're at the top of the hour, that we're actually going to be able to capture anymore. So we will ensure that all these questions and answers are retained. Any items that are new that aren't previously contained on the Q&A document, we'll make sure we get added and get answered. Any that we haven't gotten to, you're always free to email those questions to the DD mailbox that you see on your screen. Again, we'll get those updated on the question and answers document. So at this point in time, we will conclude the call, and just want to thank everybody for their continued interest in best supporting the needs of the folks that we have the humble opportunity to support, and ensuring that you're doing so in a best practice way. We appreciate your questions and time today, and keep an eye open on your mailboxes, as there will be additional sessions related to the other service definitions that were revised in the waiver application. Thank you.